Hi friends, gum recession is when your gum tissue pulls away from your teeth, exposing the roots underneath. It's caused by a number of factors, including aggressive brushing, smoking, and even genetics. Treatment including antibiotic, antimicrobial mouth rinses, and surgery. Aggressive toothbrushing is a type of trauma that can cause gum recession, but other type of trauma can lead to shrinking gums too. If you take a blow to mouth or fall and hit your face, it may cause your teeth to become loose or malpositioned. The early stages of gum disease, gingivitis, leads to red, swollen gums, and if you ignore it, it can progress to periodontitis, a more advanced form of gum disease that involves the bacterial buildup, inflammation, infection, and gum tissue damage, including recession. And orthodontic therapy in the form of braces, spreaders, and invisible aligners is an excellent way to straighten your teeth to improve your oral health, but constant force that reposition your teeth. How can we fix dental recession? Gum recession is a gradual process, and many people don't realize they have receding gums until it's already occurring. Signs of gum recession is vary but can include red or swollen gums, bad breath, mouth sores, and pain or bleeding when brushing or flossing. Though damage to gum tissue is not reversible, your dentist may recommend one of the following procedures depending on the cause and severity of your gum recession. The treatment include the deep scaling and the flap surgery. If your gums already have pockets that are too deep or you have experienced too much bone loss, a deep cleaning won't be enough to treat the gum recession. In these instances, surgery may be necessary. Bone regeneration and tissue or gum graft are the two procedures frequently recommended to address receding gums. Regardless of the cause of gum recession, preventive measures should still be taken to keep it from advancing.